the 5 best thyroid labs to have drawn and the one you shouldn't bother with. I'm Dr. Mona Morstein. Welcome to my channel. Today, we're going to be talking about the 5 best thyroid labs to have drawn and the one you shouldn't bother with. If you haven't already subscribed to my channel, please click below. Otherwise, let's get started. So, hypothyroidism is pretty common in our country. About 5% of people aged 12 and above in our country have hypothyroidism, and as a result have problems until they're diagnosed of fatigue and coldness and dry skin and hair loss, weight gain, water retention, constipation, problems with the periods, depression, and so forth. And nobody wants to live a life with those symptoms. It really impacts the quality of life. Now, when we're thinking, wow, a person could have a thyroid problem, the best way to measure the thyroid is ideally to do a fasting thyroid and make sure that you're not taking any biotin for at least 1 or 2 days before. Now, biotin is in a multiple vitamin mineral, and it's also in products for the hair, skin, and nail. And the thyroid machines at labs use biotin in their analysis of thyroid hormones, and taking biotin could kind of screw up the readings, right? Now, if you are already on thyroid medicine and you're taking it in the morning, you want to skip the morning dose, get your labs, and then take your thyroid. If you take your thyroid at bedtime or maybe the middle of the night, 3 a.m., you can take it and then just get your labs drawn in the morning as usual. TSH is lowest in the morning, so that's our best bet to get the most accurate picture of it, and then it gets higher as the day progresses. Now, the first lab that we want to do is TSH, thyroid stimulating hormone. Now, that's a hormone made from your pituitary, and it's telling your thyroid, hey, make some thyroid hormone, right? Now, here's the deal. There are different ranges for what we would find acceptable with the TSH. So there was this NHANES 3 study, and they said that a TSH is kind of fine to 4.5, units, right? But the National Academy of Clinical Biochemists said, not really. When we analyze healthy people that are healthy, nobody's really got a TSH over 2.5. Now, for some reason, the MDs, conventional medicine, went with the NHANES number, 4.5. And so you're always going to see 4.5 on regular lab results. But integrative physicians like me wanted at 2.5 or less because we go by the National Academy of Clinical Biochemists' understanding and research, right? Now, the TSH is affected by serious illness, some medications. Unfortunately, those people who are having anorexia, people who have benign pituitary adenomas, and in general, we want it in the normal range. The low is generally, say, 1 to 2.5. If the TSH is too low, that's good for the class of patients who have had thyroid papillary cancer, because a low thyroid has been shown to really, really reduce recurrence of their thyroid cancer. So people who have had thyroid cancer, we want a low TSH. The problem with a low TSH is that it also causes bone loss. So we don't want it low in a regular person who hasn't had thyroid cancer. And even in a person who's had thyroid cancer, we want to make sure that we're still supporting their bones as we keep their TSH low to prevent cancer recurrence. Okay? TSH can be high if you have a high BMI, if you're overweight, particularly with abdominal being overweight and you have high lipids and blood pressure. Things like prediabetes, these sort of things can raise the TSH. Now, the TSH gets feedback from T4. Now, T4 is about what 97% of the thyroid makes, which is inactive in the body, right? So we make this total T4, but we measure free T4. The other T4 is bound to thyroid binding globulin, and that's not helping us. We want how much is free that can actually be converted into T3. So T4 has 4 iodines. It's not active. In the cell, we take an iodine off. It's T3. Now it's active. So we have to measure both free T4 and free T3. Now, why do MDs refuse to draw free T3? I don't know. You gotta ask them. But any physician like me is always going to include free T3, the active form of the thyroid, because sometimes you can have a good free T4 and a really low free T3. So that would mimic, if you didn't know the free T3, you'd think by the free T4, wow, they're doing great. But they're not converting to the free T3, and they're not going to feel great or do great, right? So we have to measure all of those, both of those. The other ones are the antibodies. So we have thyroid peroxidase antibody and thyroglobulin antibody. If those are positive, they have Hashimoto's thyroiditis, which over time could lead to hypothyroidism, a low-functioning thyroid. There's another antibody called TSI, thyroid-stimulating immunoglobulin. If that's elevated and the labs are showing that, that could be hyperthyroidism, Graves' disease, where too much thyroid hormone is being made. So these are what we want to draw: TSH, free T3, free T4, and the thyroid antibodies. Now, what about reverse T3? No, that is not beneficial as a lab. So when we have T4, it can either make T3 or it can make reverse T3. This to free T3 requires selenium and zinc. And this is kind of the reverse T3 is the trash thyroid. That's how we throw thyroid out of the body. But it has a lot of things that can affect it. Many times people will draw it and say, oh, it's high, so that's a reflection of your thyroid. Not necessarily. Reverse T3 can be elevated with a reduction in your metabolic rate, if you're on a low-carb diet, if you have congestive heart failure and AFib, if you have a serious illness or even a serious injury, that can cause it. Just stress, whatever that is in your life, just being a little older. The elderly tend to have higher reverse T3. So this is not really a very clinically helpful lab. So you don't need to have reverse T3 drawn. Now, generally, subclinical hypothyroidism is high TSH, but normal free T3 and free T4. And generally, I don't want to treat that. I just want to support the thyroid. I do want to treat it, but not with thyroid hormone, because we can strengthen the thyroid, make it stronger, and work better. So that means the pituitary is kind of yelling at the thyroid, but the thyroid is slow at producing hormones. Otherwise, if we have high TSH where it's yelling at the thyroid and the hormones are low, that's hypothyroidism. And that does almost always need to be treated with thyroid hormones. So thank you for watching. That was a nice discussion on thyroid labs and what to do and what not to do. If you like this, please like it below. And please subscribe to my channel. If you would like a free download from me or you'd like to schedule an appointment, please find those links in my bio below. Thank you. I'm Dr. Mona Morstein.